Hi, we're here today to talk about progressing with vaginismus using dilators. Joining us is Dr. Sara Sohn of Knockout Physical Therapy, and we're really happy to have you. Can you explain a little bit about yourself and your practice?
Sure. Hi. I'm a doctor of physical therapy and I specialize in pelvic floor physical therapy and particularly helping people with pelvic pain, so painful intercourse and other things like incontinence, constipation. And I love what I do. I have my own practice in Florida and I also treat online. So thanks for having me.
Yeah, I'm excited. A lot of people know the word vaginismus, but I think there's many different definitions, sometimes misused and correctly used. So I thought it would be good to start if we could just kind of explain vaginismus and kind of definitions that you prefer to use to describe this condition.
Sure. So I think that the umbrella term for pain during intercourse is dyspareunia. And vaginismus, usually what people are talking about is that the muscles of the pelvic floor, right at the opening, so here at the introitus, are contracting prior to insertion. However, I like the term hypertonicity because when somebody is using vaginal trainers, oftentimes they're having hypertonicity, and that's why they were prescribed or decided that they read some things and watched some YouTube videos that a dilator would help them.
Okay. So who does this usually affect? I know that I've seen a lot of younger demographics, but I've also heard, and in our studies at Milli, a lot of focus now is on more menopause aged women. And so I'm just curious about what types of patients you see, who do you see this usually impacts, and any information like that.
Yeah, so it's so interesting that you asked that because pelvic floor hypertonicity, meaning like the muscles of the pelvic floor contracting and having a difficult time resting, can look like so many different things. For example, so many people will be leaking urine and have incontinence, and they're like, "Oh, I just need to do Kegels all day," and oftentimes that's not the case, right? So think about other muscles in our body; those muscles can be overcontracted or in spasm, and therefore you still have weakness in those muscles. So you can still have a weakness in a muscle that is over contracting because a muscle can't get strong if it's not able to go through full range of motion. It's like doing bicep curls, kind of like that, right? So some people are really surprised at the fact that they might have incontinence, they might have a sense of urgency, they might have a sense of difficulty emptying their bowels, emptying their bladder, constipation. They might have a sense of feeling like they're sitting on a tennis ball, difficulty inserting a tampon, difficulty having a gynecological exam, let alone any type of insertion. In addition to feeling sometimes of a tingling sensation in this area, they can have low back pain, lower abdominal pain. So these types of things, people don't even realize that they're connected to their pelvic floor, right? Like nobody would think it's like, oh, my hip hurts. Well, your hip and your pelvic floor are really close together. So you brought up in older people, anybody that's had surgeries to this area, a hysterectomy, can often have pelvic floor overactivity postpartum. So it's a broad group of people.
Okay. And you mentioned Kegels. And that's often, I think, a solution a lot of women know of. And I feel like it's a very historically used solution. But what other solutions do you recommend if Kegels isn't the most ideal? What is the most ideal that you find in your practice?
So I think awareness of pelvic floor physical therapy and having an examination to really understand the why, because why are you having that problem, because it's not a one size fits all type of solution for anybody, I think is the best advice that I could give in terms of other things that you can do besides Kegels. Well, one, it's making sure that you're getting proper contraction and proper relaxation of that muscle. And And once you know the why, you can work on that. So is it the hip external rotator? Is it, pelvic floor overactivity? How can you really learn? But in the scope of what we're talking about today, I think really understanding your own pelvic floor anatomy and really understanding what it feels like when it's contracted and when it feels like when it's rested is just getting that will bring you leaps and bounds towards your own healing.
Okay. And what tools then help that? Because that is a very foreign, even when I'm thinking about that, when you're explaining it, I don't know how to even do that with my muscles.
So one of the things is when people think of pelvic floor weights or things like that, right? What helps is the just feeling something there, the proprioception. That's the word for where our body is in space, of just feeling something there. So that's one of the reasons I love the Milli vaginal trainer, because for somebody that's having pain, they can insert something super small and they can get a better sense of proprioception of, am I contracted, am I rested, with just the trainer. So that's one of the reasons I really like something like this. Some people have a hard time even feeling those muscles. So the fact that this one vibrates, I think is really helpful as well, because they can feel, oh, that's the muscle. Okay, yes, I'm squeezing it now. I'm resting it, along with all the other benefits of things that you can do with a vaginal trainer.
Okay. And then you mentioned pain, and I know we talked a little bit a few minutes ago about urinary incontinence and frequency, but where does that pain, is that more attributed to the insertion side of that when there's painful sex? Is that the pain, or can pain exist outside of that as well?
Yeah, so people that have hypertonicity of those pelvic floor muscles can have pain sometimes just sitting, sometimes and then sometimes it expresses because it refers pain, right? So in our brain, there's certain areas of our brain that innervate or that make certain muscles do things. Well, there's a lot of overlap there. So some people have pain in another area right next to the pelvic floor in our brain, right? So that's our lower abdomen. And so they'll have pain there and they might not even realize it's from their pelvic floor. But oftentimes people will have, and somebody watching this, it's, you're like, oh no, just the idea of inserting a finger, inserting a tampon is scary. It's very, very likely, that should not be something that is painful. So if it's very likely that you have some hypertonicity, that you would benefit from, one, seeing a pelvic floor physical therapist, and also learning how to use a vaginal trainer appropriately.
Okay. And that's probably why the vaginal trainers are best used, because their length and the ability to go from one size to the other because of that hypertonicity that's happening. I think the involuntary use of muscle spasms, is that kind of why you would recommend dilators over Kegels in that situation, just because of the ability to practice the muscle contraction? Or
so no, that's one part of things, is learning how to rest those muscles. However, what most people use the vaginal trainer for is to learn how to keep those muscles rested while something is inserted, and starting with something that is smaller than the tip of my finger. So that way you can progress. And there's different types of progression with the Milli. You increase it 1 millimeter at a time, which is unique. So that way you can slowly learn to keep those muscles rested with insertion from the vaginal trainer.
okay. And that's where that whole progressing with vaginismus using dilators comes into play, because you have to gradually progress, and that's
Yes.
the process.
Yes.
And so what do you typically see as that process for women with vaginismus who are experiencing this either at the onset of youth or just out of the blue because they did have a procedure done or some kind of impact, trauma? What is that usual time frame that we should expect to just progress and get to the insertion stage, whether it be with our partners, with vibrators, anything that's sexual health or intimate health? how long is that progression, or what do you recommend?
So that's always such a hard question to answer. And I think what you're getting at is primary versus secondary types of pelvic floor issues. And I would say that in terms of how long, that all depends on the person. And I think taking your time and understanding your own body and the rate at which it can relearn how to do certain movements is important, because a lot of people want to rush the process, but I think there's a whole progression there. And so the progression, when people think of vaginal trainers or dilators, right, they often have gone to see 6, 7, so many different doctors already. And then eventually they'll either find it on the internet or somebody hands them a bag of dilators. And it's really scary, right? Because some of them are large and it makes them feel, a lot of these people already feel very defeated and like they can't do something that they wish that they could. And so it makes them feel even worse when they try to do it at home and they're not successful. So I think really taking your time and working with somebody that can take you through a progression that's perfect for your body is the most important. And so that's what I wanted to talk about a little bit today, is what that progression could look like, what that might look like from you now are comfortable using something like this and you want to be able to be intimate with your partner.
Okay. Yeah. So what does that kind of look like? So, I mean, when you're kind of coming up with a treatment plan for your patients, how do you start, or what is the pathway that is expected? And do women have to start out with an expert like you, or what do you see as being able to do this independently, but also with a resource? Because I know financially it could be difficult for some women, and do they have to go in once a week, twice a day? You know, how's that look to progress? Are there things they could do at home too?
Oh, that's quite the question. So there are many things that somebody needs to be doing, and really understanding the why. I do believe that that's important. So I do believe it's important to see somebody like me in order to understand why you're having those problems. However, I know when I see people, I do a comprehensive understanding of why they're having that problem. And there's a lot that you can do independently, and then kind of just check in with me every few weeks, right? So there's always ways to kind of work around someone's financial situation and things that you could be doing at home. And so having a home exercise program and a home routine is imperative. So for people that have this, and you're not going to hurt yourself, right? So just, if it's really extremely painful, nothing that we're saying is diagnostic, nothing that we're saying is prescriptive. I really do believe that everyone should have a thorough understanding of their body from a pelvic floor physical therapist, but there's nothing that you are going to do that's going to make lasting damage. This is safe. It's just, what's the best way to let your brain know that this is safe? What's the best way to progress in order so that you feel you can heal the most effectively?
Okay. And we find at Milli with Milli being a single inserted dilator where it can expand gradually, that is probably, for us, we see most effective for women with vaginismus because of the mind-body connection. And working with a specialist like you, they can go set a goal, come back home, and gradually progress with one insertion versus multiple sizes, and that fear is more alleviated because they're not retraining their body every time they take something out and put it back in. Do you find that that's also something with the mind-body connection that you see resolved if it's not jumping from sizes, or how do you kind of navigate that with women as well?
I would say bigger is not better. No, so seriously. So learning to understand your body and learning how to not have fear to use this is the most important. So I'll kind of go into that progression a little bit, if that's okay. So the first thing I recommend everybody do, and I have a self-exam that you could do at home, is to understand your own anatomy. So the first thing that people do, I want them to understand their anatomy. I want them to look in the mirror. For a lot of people, especially anybody that's been through trauma, this is terrifying. Just looking in the mirror at their own pelvic floor is terrifying. And so when you look at your pelvic floor, what you're looking at, so just so people can be oriented, this is the front of somebody, this is the back of somebody, and this is the floor, the base. And so what you're looking at is, I want you to look right here. This is the perineum, or the space between the vagina and the anus. And for a lot of people, just looking is scary. So I recommend to do that every day for a week, right? That's the first thing. Then look at that space and see if you can see it move at all. When you try and contract it, and you see how they're connected? So it's like you're holding gas, right? So it's the same feeling. Try to contract and then try to rest, yeah? And can you see this move? Can you see this rest? So that's the most important there, understanding your body. Then can you touch with just your finger? Can you touch here? Can you massage this area? Can you insert a finger into the opening of your vagina and just feel? And for some people that takes a week, 2 weeks. Just the idea of thinking about these things. I know when I said vagina, somebody out there is like very anxious just from me saying that word, right? So for some people, that even that progression takes a long time to get to this point of, I now feel comfortable even thinking about this. Okay. Then, and only then, once you're able to do that comfortably, do you start using a trainer. And when you start using the trainer, I recommend people use the smallest size and just insert it to where they feel comfortable. People ask me, should I have this pillow here or this pillow here? And it doesn't matter. I just want you to feel comfortable. Some people feel the most comfortable with their legs kind of splayed open like a butterfly with pillows underneath and their feet together. And there's a reason for that. You're actually externally rotating your hips. You're lengthening those muscles. You can feel the rest a little better. But I want you just to insert it. So you'll insert it and leave it for 5 minutes. 10 minutes. You do this every other day. When that gets easy, try and move around a little bit. Stay with the small size. There's no rush. Once you get super comfortable with, that's what I love about this, is that it's so small. You don't have to rush it. You don't have to, bigger's not better, okay? You want to feel comfortable being in different positions and you're on your bed, making it so that you aren't, it's something that is you time. It's not a, it's the anxiety is getting less and less. Over time, then increasing it 1 millimeter at a time and practicing making sure your muscles are rested and inserting it and being in different positions, things like that. So you do that on your own when you have in privacy, always making sure you wash the device, use lubrication, water-based lubrication, because this is a silicone, every time that you use it, and every other day. And then eventually, once you've increased size, and now everyone will ask me, well, how big? You know, you can, some people say to the size of their partner, but it doesn't even have to be that far. It could just be to where you feel comfortable. Like I'm now feel really comfortable using this, right? It's not a big, scary process. And then there's a progression to including your partner for people that have a partner that they want to be having insertion with. Okay. Right. And sometimes the main goal isn't insertion of penis into vagina. Sometimes they're same-sex couples and it's insertion of toys, insertion of fingers. So there's that progression is really scary. So the way that I recommend that progression, is it okay if I keep going?
Oh yeah, this is very helpful.
Good. Is it helpful? Okay, good. So the way that I recommend that progression going is once you're comfortable using the vaginal trainer to that size, start with using the trainer. Now, this might take weeks, and that's okay. Take your time. Start with using the trainer with that other person just in the house. Yeah. And tell them, this is not a sexual thing for me. This is I'm learning how to heal my body. And so I need you to not sexualize it. I need you to understand that that's what I'm doing and not sexualize it. Just make me feel safe. Just be in the house. Yeah. Then maybe have them in the room. And now they're in the room, and you're just talking and you're laughing. And the more often you do this, the more comfortable you'll be able to, like, how ridiculous is this right now? Like, I'm using a vaginal trainer and you're in this room. This is weird. And you gain that trust with that person. And then over time, and all of this is again with the smallest size. So you increased on your own, but now you're going back to the small size and you're doing that with your partner.
Okay.
So now your partner might just have their hand on your leg. And this is just, you guys laugh, watch a movie, it's just insert, you don't have to do anything. And then maybe that person has their hand, on top of your hand. So you have control, and the whole time you're practicing saying what you are comfortable with, what you're not comfortable with. You're practicing saying, okay, you can insert it a little bit more, which is very important.
Mm-hmm.
And then, and only then, so now you use this trainer, how to relax those muscles, how to use this in different positions, but on your own, you feel comfortable, and like it's a fun, funny, usually, experience with your partner, vulnerable. You can you have control and you have the voice, and you tell them, okay, I'm gonna have you insert it. Okay, and remove it. Getting comfortable with them, maybe inserting it and just leaving it there, maybe inserting it and removing it. And oftentimes people, they're doing this, but at this point, now that you've gone through this progression, it's fun. And it's not something that you're not having to wince, because you've given yourself that time to relearn how to keep those muscles rested and to feel comfortable and safe with your partner. And then, so once we get to, I recommend when it comes to intimacy and sex, right? So there's lots of things that people are doing while people are using the trainer to get to that goal, if that's their goal. I do recommend not having this part with your partner be sexual. So sex is great, and you can do all different types of sex, but like, at least 20 minutes after, 20 minutes before, I don't want it to be a pressure situation, right? So it's a non-pressure, this is my healing my body. So the first time that insertion happens with someone, with a partner, like penis into vagina, if that's what they're doing, or a larger toy, I want it to be treated that way too. It's a non-pressure situation. The orgasm doesn't have to happen, even really just completion of any kind doesn't have to happen for anybody. This is only for the purpose of the same way that you were practicing with this together, you're now practicing that way together. So I often recommend that they just insert, and maybe for a minute or two, and then you guys go on with your day. And that becomes super easy. And then eventually you can transition that. Like, I'm also a sex coach, and I help people, I'm becoming a sex counselor. And so I help people with that progression too, of how to make your partner feel desired throughout this whole time, because they're here to support you. And all they want to know is that you still love them, still find them attractive. And they're here to support you and to help you on this journey together. So, and it can really bring two people closer together if they are vulnerable enough to involve each other in the healing journey.
Mm-hmm.
I hope that made sense. I'm going to be doing a Facebook Live where I can elaborate on this more and can answer questions soon, because I think that that's a very big, broad topic, trying to condense it.
Really well, but obviously there's going to be every person viewing this is going to have their own unique situation or cause or reason why they have vaginismus, and some may have partners, some may be married, some may have no partner and just trying to date again, or realize they have something going on because they went on a date for a first time in a long time and realized like something's going on down there. So I'm sure you're going to have many questions, because I know we get a lot of questions through Milli for her, and a lot of them do come from the husbands or the partners of the women experiencing this, or the person experiencing this. And I think it's really important to have that safe forum with an expert like you to be able to talk about it or ask questions. So very excited about that. You also mentioned that you had a quiz that you developed, and could you tell us a little bit more about that? Because I think that's also a great tool.
Sure. So many people don't even realize that they're having pelvic floor. They might have pelvic floor issue. And so I just developed a quiz that asks many different questions that could lead to someone being more aware that they're even having a problem down there, because it doesn't always, it's like you said, it's not always this younger person that can't insert a tampon. There's lots of people that have these issues of all different ages, of all genders. And so I created a quiz on my website, and I'll attach that for you guys to take, and that might help you have a better idea and a better understanding of your own body, and like, oh, that's why I've been experiencing that, because that alone is empowering to a lot of people. Just understanding why they're experiencing a certain problem, because when you have a problem down there, it's scary, it's really anxiety producing. Even though it's a muscular problem, I don't know about you, but I'm much more scared when my most vulnerable space in my body is having a muscular problem as compared to my shoulder, right? So even that alone can be really empowering, I think.
Okay, I'm really excited about the quiz. I think it will help. I think a lot of us do go through experiencing different journeys with our vulvas and the vaginal canal where we're not sure what's going on, and we're not going to talk to our gynecologist about it because that's not a forum usually that's as inviting as someone like you who's just using terminology and models that are safe for us and make us feel normal. So thank you for providing that content for us, and then also excited about the Facebook Live as well to just create a forum for questions and more deep dive into this topic. So thanks for joining.
No, thank you. Thank you so much. I really appreciate you saying that. And I am here to make people feel comfortable. So feel free to ask any questions. That's what I love doing. So thank you for saying that. And if you watch this, thank you so much for watching, because I know it takes a lot of vulnerability just to even think about this area. I know for me, I always say this, but it's like, I talk about pee, poop, and sex all day long. So I can say the word vagina, it doesn't scare me, but for other people, that could be really overwhelming. And so I really appreciate the space that you took today to learn and to listen and to maybe be a little uncomfortable. So thank you.
Yeah. All right. Thanks. Bye.